Transitioning into bone and joint injuries, there's quite a range and variation in what we see with joint and bone injuries. So the main four categories are sprains, strains, fractures, or dislocations. So with strains, it's overstretching the muscle or tendon. Sprains are when there's an injury to the ligament, which is what's holding the bones and joints together. A fracture is any sort of break, chip, or crack in the bone, and a dislocation is when a joint is out of its normal position. When looking at joint health and muscle health, okay, what are we looking for? We're going to do the DOTS system. So is there any sort of deformity? Does something look different than it should? Open injuries, so can we see the bone? Can we tell that it's broken? Any sort of tenderness and swelling? Is there any sort of moderate or severe or pain or discomfort? Bruising that can happen. It's important to note that there doesn't need to be bruising, right? Inability to move or use the affected joint or muscle. Any sort of fragment sticking out of the wound. Feeling the bones, getting the sound of that, right? So you may have heard people explain, oh, well, I heard it pop, or I heard it snap or crack, or whatever the case may be. Loss of circulation, so our CSMs, as we've talked about previously, so being able to actually feel that blood is making it to the extremity. And then what was the cause of injury? Was it a fall? Was it a trip, right? What caused this? Was it something falling onto the person? So to give care, we're going to determine which part of the body is injured. So it's important, again, to remember that when we're looking at these things, that we always start with that full patient assessment, right? We want the person to rest and relax. Sometimes the initial feeling goes away and people can continue. And if it gets worse or stays the same, then we know how to move forward. Remove any sort of clothing and make sure that you look at the injury site and actually expose it at the skin, okay? So if someone's grabbing their arm, you come around the corner, someone's grabbing their arm, and they have some tenderness, you're going to want to make sure that you expose it at the skin. That way you see if there's any sort of bruising, you see if there's any sort of blood, anything like that, okay? Visually inspect the entire body from head to toe. The reason that we do this, right, that head to toe, we've talked about this, we do the patient assessment. The reason that we do this is because if I was to fall and hurt my shoulder, that might be the biggest pain at that moment, but that's not necessarily, doesn't rule out the fact that I hit my head or I hurt my spine, something to that effect, okay? We want to see if does the person easily move the injury part, or is it very guarded? The most important thing to take away from a care system is the RICE method. So having the person R, rest, I, immobilize the injured area, C, apply any sort of cold. Luckily in the Sierra, we're surrounded by pretty cold water. And E, elevate. So trying to get that above the heart, right, to prevent any sort of swelling. After about 20 minutes of RICE, remove the cold and let the joint warm naturally for 10 to 15 minutes before testing and determine if it can be used. If it's getting worse, if it's getting better, if the person can hike up themselves, continue, so on and so forth. The injury will heal faster if you use the RICE method 3 to 4 times a day until the joint or muscle has gotten better. So a form of treatment, and this is actually what your assignment is going to be for this, a form of treatment is going to be splinting, okay? If you're splinting, we're going to remember that we're doing this right all in the backcountry scenario. In the wilderness or remote setting, chances are the person will need to be moved, right? So when in doubt, splint. If we think that there is a chance for any other sort of major injury, we want to splint the area. Our goal is to splint without causing more pain, okay? Removing rings, bracelet, watches from the injury. So remember, there's a chance for swelling, and if we splint it, it might be a day or two until the person's out of the back country. We don't want to have cut off any sort of circulation because of that swelling from any sort of jewelry or something to that effect. Okay. Always place padding around the splint. There's additional videos for you to watch on this section. Fill in any hollows with soft padding, so we don't want any sort of pressure in any one point. Think of like if I was to use my elbow, right? That's a pointy part of my bone, and so we'd want to put something soft so we don't end up with any sort of pressure ulcer or something like that, okay? Be sure that the splint is long enough to restrict the movement of the joint below and above. So for example, if I was to break my shin, I would want to splint my knee as well as my ankle, okay? So the joint both below and above. Prepare the splint before moving the limb, so everything should be ready to go, right? Least amount of injury and pain as possible, okay? Splint an injury in the position of function or as close as possible. So like we just talked about. Remember, all of this stuff is in your digital book that has been posted on Canvas. Splint the injured area and the bone or joints above and below the injury like I talked about. Attach the splint with a number of bandages tied to secure the knots and monitor the injured area. It's important that every time you put a splint on that you check those CSMs, right? Can you feel the person's CSMs under or in the distal part, the furthest away from the body part of the arm or leg. Strains and sprains. So when we're doing this, we're checking the person, okay? Have the person actively move the injured part. If they can move it, then we know how to move forward. Move the joint yourself and evaluate the person's response. If the joint appears to be usable, have the person test it on their own. Tell the person not to use the injured part if movement causes pain. And if the injury is the lower part of the body, see if the person can use it without pain, okay? Offer any sort of appropriate support. Injured knee, provide a walking splint, which restricts the movement. Again, there's videos on each of these types of splint on your module. To give care, splint any injured bone or joint that the person cannot use, okay? So when in doubt, splint. Fractures. So checking for a fracture. Determine if the injured part looks broken by comparing it to the uninjured part. So what's nice about our limbs is that we have another limb, right? So looking at the size of a person's wrist on their injured wrist, compare that to their good wrist. Gently touch the injured area and look for these signs, okay? So if the person reacts quickly to the touch, the muscle spasms near the area that you're touching or the pain, the injured area feels unstable, and one spot hurts noticeably more than others. So if you're feeling up and down the arm, there's a very specific point where the person is feeling that pain. Where the person is feeling that pain, there's a chance that that is a fracture. Again, checking CSM, okay? Do you feel the pulse on the most distal, far away part of the body? Okay. Any sort of tingling, inability to move signs, that's the sign of a very serious fracture because it is inhibiting the body's ability to get blood to either that specific area or an area further distal from the body. So, to give care. In general, splint any injury that you suspect a fracture, if there's any chance that there is a bone break or a fracture, right? And always continue to check those CSMs. For a jaw fracture, hold the jaw in place with a wide wrap that goes around the head. Make sure that the wrap can be removed quickly if the person needs to vomit. For a collarbone fracture, secure a sling and swath. Make sure the sling is a triangular bandage. Be sure the slings lift the elbow to take pressure off the shoulder. For a lower arm fracture, including the wrist or hand, make sure that you secure the injured part with a well-padded, rigid support and place the roll of something soft on the hand to keep the position. Okay, again, there's videos of how to do these splints. If there is any sort of complicated fracture, so it's something that you don't feel like you can secure properly, okay, pull the gentle traction along the line of the bone. This will relax the muscle. There's a video of this online to make sure that you do this correctly. But what I want to remind you here is do not use force. If it doesn't happen easily, don't do it. Don't cause a bigger problem than there already is, okay? Do not continue if the person complains of increasing pain. Splint the injury once the injured part is aligned. Okay. For an open fracture, meaning it has actually burst through the skin, so it has created a wound, make sure that the bone, that you are cleaning the area, and the wound and a healthcare provider is longer than 4 to 6 hours away. That's when you want to clean the wound. This is everything in the backcountry is done with filtered or purified water. Apply a gentle inline traction of the fracture, pull the bone. Again, you only do this if you cannot have help for this person in a rapid evac in longer than 4 to 6 hours. Dress the wound, splint the fracture. Dislocations. Follow these principles. The only treatment available for certain dislocations that occur in the wilderness is splinting in most comfortable position. Okay? It is not your job to put the dislocation back. It is your job to splint it, put it in the most comfortable position for the person, and then evac them. Okay? So even if at this level, if you decide that you want to be able to reset certain dislocations, then you can take a wilderness first responder class. When checking the person, look, listen, and feel for a joint that does not look right, okay? So again, if something's off, and you can compare it to the other arm or wrist, the leg, knee, hip, ankle, right? If the pain or loss of normal range of motion, a bump or ridge or hollow is not normally, that does not normally exist. So when do you call for help? So guidelines for your evacuations. You're going to go slow with anyone who cannot use the injured part of their body and is suffering from a first-time dislocation. We want to evac them if that's the first time that that body part has ever dislocated. Okay? If they can use it, you're going to walk them out. You're going to go slow, but make sure that we're still evacing. Now, there is a rapid evac of anyone with an aggregated fracture, open fracture, fracture of the pelvis, hip, or thigh, or more than one long bone fracture. So let's break that down. If the person has an open fracture, meaning it has bust through the skin, it is a rapid evac. If the person has fractured their pelvis, their hips, or their thigh, right, we can call for help. That's a rapid evac. We can litter, walk them out, whatever the case may be, but we're still going to try and stabilize that hip, thigh, or pelvis. More than one long bone means more than one bone. Long bones are going to be any bone that is longer than it is wide, okay? So that's every finger digit, forearm, upper arm, anything on your legs, okay? More than one break, rapid evac. It's also a rapid evac if there's any sort of decrease in CSMs. Okay, so again, those CSMs, right, being able to check for pulse on the most distal part of the body.